Hi, I'm Heidi Toby, Director of Social Work Programs at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. Today's topic is consultation with colleagues. On the ASWB exams, both the LMSW and LCSW, there are many reasoning-based scenario questions that offer the answer option to consult with colleagues. I've had a number of social workers email me coaching questions about this, sharing their difficulty in identifying when this is the right answer and when it's not. Sometimes consultation will be the correct answer, and other times it won't be, which can make this answer option feel challenging. The good news is there are some clear guidelines to follow for these questions. Today's blog covers some of the scenarios when you want to choose this answer, as well as some scenarios when you do not. When not to seek consultation with colleagues. You won't seek consultation with colleagues on the exam unless there is a clear reason to do so. I like to think about this from a really practical perspective. In our clinical work, we don't consult with colleagues on every client situation, right? So we also aren't going to do this for exam scenarios. Don't choose this answer option unless there's a clear reason to do so identified in the STEM, and we'll go into some of these below. For purposes of the exam, I would also say that you don't want to choose consultation with colleagues when there's an answer option to consult with a supervisor. Prioritize consultation with a supervisor or seeking supervision over consultation with colleagues unless it clearly specifies you're in a setting where you wouldn't have a supervisor. Specifically around issues of countertransference and values conflicts, the exam is looking for the social worker to consult with a supervisor. So if you see an answer option to consult with a supervisor and another answer option to consult with colleagues, go with consulting with a supervisor unless there's a really clear reason to consult with a colleague. Next month's blog, the first of 2021, is going to be on when to seek supervision. So be on the lookout for some info on this important topic. When to seek consultation with colleagues. It's a good option to seek consultation with colleagues when consultation is needed and supervision is not an answer option. In real life, we seek consultation when we need support, not for every client situation. So if a question STEM specifies that the social worker is unsure of how to proceed, consultation is a great answer option. Or if we're lacking knowledge in a particular area and there's an option to consult with a colleague knowledgeable in this area, that is a good answer option to go with. Let's try a practice question. ASWB practice question. A social worker has been meeting with a client for 2 years. Recently, the client shared that they have been experiencing harassment at work, and despite speaking with their manager, it isn't getting better. After the session, the social worker realizes she is unsure of how to help the client around this issue. What should the social worker do first? A, refer the client to a social worker who specializes in workplace issues. B, consult with a colleague. C, encourage the client to express their concerns to HR. Or D, encourage the client to seek employment in a safer environment. The correct answer is B, to consult with colleagues. This might have been a little too straightforward since this week's blog is titled Consultation. But A is incorrect because there's no need to refer a client of 2 years to another therapist for a situation like this. C would actually be a great next step if the question didn't specify that the social worker realizes she's unsure of how to help the client around this issue. Because it specifies that she's unsure of how to help the client around the issue, it suggests that she's unsure if C is an okay thing to do. If it hadn't said that, we could have chosen C. It is likely that consulting with colleagues, B, may lead the social worker to doing C. D is premature because the client hasn't stated that she wants to leave her job. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.